Today we will discuss about the muscles of the anti-abdominal wall, as well as the mainly we will discuss about the inguinal canal. First of all, I have got the midline incision of the anti-abdominal wall, and from the pubic tubercle to the anterior superior iliac spine I have cut, and horizontally I have cut from the lower border of the xiphoid process, and horizontally I cut the anti-abdominal wall. After reflecting the anti-abdominal wall, skin of the anti-abdominal wall, you can see there is a another two layers of the superficial fascia. One is the fascia camphor, it is a fatty layer, and the another is the membranous layer. Both are united. So the fascia camphor, it is considered as a fatty layer, and the membranous layer, it is considered it is fascia scarpa. Here you can see these are the cutaneous nerve, which is 7 to 12th intercostal nerves, which is supplies to the wall of the anti-abdominal wall. After that, I have reflect the, you can see there is a fiber of the external oblique which is attached to the lower 8 ribs, and it is inserted into the linea alba as well as midline. And the most lower fiber, I have also reflected the skin of the femoral triangle, and I will show you the other structure even inside the femoral triangle. So here the most lower fiber of the external oblique from anterior superior iliac spine to the pubic tubercle, this lower fiber of the external oblique, it is considered as a inguinal ligament. And this inguinal ligament, which is the most lower fiber, and it is medial half, which is uprolled, and it is forms the one canal. It is called the inguinal canal, which is into the medial aspect of the half of the just above to the mid-inguinal point. So mid-inguinal point, there is a deep above to 1 to 2 centimeter, there is a deep inguinal ring, and this deep inguinal ring, it is inside the fascia transversalis, while there is a superficial inguinal ring which is just above to the pubic tubercle, which is lies. It is a gap inside the external oblique muscles. It has a two crura. This is a medial crura of the superficial inguinal ring, and this is a lateral crura of the superficial inguinal ring. So superficial inguinal ring, it is a gap inside the external oblique muscles, and you can see here the external oblique, it is directed downwards, forwards, and medially, and this gap, which is lies on the medial aspect just above to the pubic tubercle, this is a pubic symphysis, and pubic symphysis to the pubic tubercle, in between there is a pubic crest, but due to the inside the body you cannot see here, but in body margin from the pubic symphysis to the pubic tubercle, in between area, it is considered as a pubic crest. This is a medial crura of the superficial inguinal ring. This is a lateral crura, and here you can see this is a spermatic cord, and it contains which is passes through the superficial inguinal ring. This is a nerve which is ilioinguinal nerve. After I have cut this external oblique, always you have to remember the directions of the fiber of the external oblique directed downwards, forwards, and medially. After I have cut this external oblique from the lateral aspect and also from the lower aspect, and I can reflect, you can see there are two nerves which is on the upper aspect. These two nerves, one is this is the ilioinguinal nerve which is pierced to the uh, interoblique and transverse abdominis muscles, and just above to this below to the external oblique and above to the internal oblique, this nerve which is passes, and it is a partial content of the inguinal canal. It is a ilioinguinal lung, and this is a branch of L1, and it is supplies to the skin around to the perineal region. Here you can see this is the penis, and this is a scrotum. In this area, posterior 1/3 of the scrotum, and this area which is supplied by the superficial inguinal ring. Just above to it, you can see there is another nerve. It is a iliohypogastric nerve. This iliohypogastric nerve, which innervate to the skin over the hypogastric area, which is innervated by the iliohypogastric nerve. After reflecting this external oblique, I have also cut this fiber of the internal oblique. Along with it, here you can see this. These are the fiber. This is the internal oblique fibers, and this internal oblique fibers goes upwards, forwards, and medially. And this internal oblique fiber, uh, which is attached to the lateral two-third part of the inguinal ligament, and just deep to it, there is a, after cutting this external oblique, you can see here. Here, after this cutting of this inter oblique muscles, here you can see there is a fiber of the transverse abdominis muscles. This one is the transverse abdominis muscles, and in between there is a neurovascular bundle which is lies. Here you can see this is the how to identify the deep inguinal ring. First of all, you have to identify the inferior epigastric artery. I will, for that I have cut the rectus sheath, and you can see there is a, this is the rectus abdominis muscles, and this rectus abdominis muscles, this is the arcuate line, and just below to this arcuate line, over this area here, you can see this is the vessels. It is the inferior epigastric artery vessels, and these inferior epigastric vessels here at that level, inside the femoral triangle, here you can see this is the femoral artery, and from this femoral artery, this is the artery which is go upwards. It is the inferior epigastric artery. Here also you can see this is the inferior epigastric artery. So inferior epigastric artery, here you can see this is a uh, artery which you can see here. This is a inferior epigastric vessels, and just lateral to this inferior epigastric artery, after removing these three layers, external oblique, this is a internal oblique, and transverse abdominis muscles. This is the transverse abdominis muscles. You can see there is a fascia transversalis, and this fascia transversalis, this inferior epigastric vessels, just lateral to it, there is a gap inside this. It is called the deep inguinal ring, and that's why the inguinal canal, which is extend from deep inguinal ring, it is the gap inside the fascia transversalis, from anterior superior iliac spine to the pubic tubercle. Above there is a mid-inguinal point, 2 centimeter above to this inguinal ligament midpoint. There is a gap inside the fascia transversalis, and this gap, it is considered as a deep inguinal ring, which is just lies lateral to the inferior epigastric vessels. So this is the gap. It is the deep inguinal ring, and this is the inferior epigastric vessels. And here you can see these are the content of the spermatic cord, and male and female, there are different content inside the spermatic cord. It is a vast difference. There is a ilioinguinal nerve, there is a genital branch of genitofemoral nerve, cremastic muscles, artery to the testis, cremastic vessels, and pumpiniform plexus. These are the content inside the spermatic cord, and this spermatic cord, after pierce to the superficial inguinal ring, it goes inside the scrotum. Here you can see this is the, again, these are the content of the spermatic cord which is going, and there are four mechanisms which is formed. Here the first mechanism you have to remember, these internal oblique muscles, the anti-relations of the relations of the inguinal canal, throughout there is a above to the all the superficial to the external oblique, and even external oblique, all this above to it means skin, superficial fascia, fatty layer, and fascia scarpa, external oblique, and skin are the uh, anti-relations of the inguinal canal. Into the lateral one third part, this inguinal canal, which is which is also by the internal oblique, and this internal oblique, which is goes on the upwards and backwards, and it along with this transverse abdominis muscles, it makes a conjoint tendon. It have three relations with the inguinal canal. It is on the lateral one third part, it forms the anterior boundary. On the upper part here at that level, it forms the roof, And on the back side here you can see this fiber which is goes on the back side, and this conjoint tendon which is lies behind to this superficial inguinal ring. At that level it makes a posterior relations of the uh, inguinal canal. So the conjoint tendon in medial one third form, it forms the posterior relation, middle one third it forms the superior relations or roof, and lateral one third it makes the anterior relations. So three places there is a it related. Lateral one third it forms the anterior relations, middle one third it forms the superior relations, and this is a superior relations, and the medial one third it makes the posterior relation, and it reinforces and it gives supports to the superficial inguinal ring, and it is a conjoint tendon. So three mechanisms it makes the anterior, roof, and posterior wall. That's why it is a Sutter mechanism which is helpful when it has a anterior and posterior, and the closing of this both the rings from the by the internal oblique, it is called the Sutter mechanism. Contraction of these cremastic muscles inside here in this cremastic muscle, it is a pinkish in color, and this pinkish color it is a continuation of the conjoint tendon or interoblique muscles. Some books consider as a conjoint tendon, some book consider as a interoblique, and it makes the cremastic muscle, and contraction of this cremastic muscles it lead to there is a spermatic cord plug inside the superficial inguinal ring. And this plugging of superficial inguinal ring, this mechanism is considered as a it is snack like the tortuosity of the spermatic cord. It lead to plug inside the superficial inguinal ring. It is called the ball valve mechanism. So two mechanisms, Sutter and ball valve. Third mechanism, this is the medial crura, and this is the lateral crura of the external oblique muscles, and this approximate both together, it is called the slit valve mechanism. And the last one, the superficial inguinal ring and deep inguinal ring, it is not into the same positions. So always you have to remember this. This is the infraepigastric vessels, and this is a deep inguinal ring. Just lateral to the infraepigastric vessels, there is a situation of the deep inguinal ring, and it is the gap inside the fascia transversally. So superficial inguinal ring and deep inguinal ring, which is apart, and the posterior abdominal wall, there is a increase the pressure. It lead to there is a both the rings which is not into the same parallel wall, and it is closing of the inguinal canal. It is called the flap valve mechanism. So there are four mechanisms. Closing of the approximation of the anterior and posterior wall, it is called the flap valve. The medial and lateral crura of the external oblique, which is approximated, it is called the slit valve. Contraction of the cremastic muscle inside the spermatic cord, it is called the ball valve mechanism. And there is a interoblique and transverse abdominis have a makes the conjoint tendon, and it has a three relations of the inguinal canal. It is called the anterior, middle part it makes a roof, and posterior part it makes a posterior relation. It is called the this mechanism, it is called the Sutter mechanism. It is a closing of the this inguinal canal. So this is the spermatic cord, and it contains, this one is the these vessels. It is the deep infraepigastric vessels and just lateral to it there is a deep inguinal ring. After that, I will show you another nerves. This is the, we already discussed, this is a ilioinguinal nerve, and this ilioinguinal nerve which is emerging from the superficial inguinal ring. Above to it, I will show you, this is a nerve. It is called the iliohypogastric nerve. This is a iliohypogastric nerve, and it supplies the skin over the hypogastric regions. Another nerve which is in here at that level, it is a genital branch of genitofemoral nerves, and these are the fibers of the genital branch of genitofemoral nerve, which is also supplies to the external genitalia and perineal regions. And some of the vein I will show you. This is the great saphenous vein, and this great saphenous vein open inside the femoral vein, and this is a superficial circumflex superficial pudental vein, and this superficial pudental vein, which tributaries, which makes drain the uh, dorsal vein of penis inside the superficial extrapudental veins. Along with it, I will show you some of the structure inside the femoral triangle. This is a, I have already removed the skin and superficial fascia and deep fascia. Here, this is the skin, then fatty layer. Deep to it, this is the fatty layer. It is a facial lata. It is a deep layers. And here you can see there are some nerves. This is the superficial medial cutaneous nerve of the thigh. It is a branch of femoral nerve. Intermediate cutaneous nerve. This is the intermediate cutaneous nerve. This is the medial cutaneous nerve. And here also you can see there is a vessels nerves. It is a this is the lateral cutaneous nerve, and you can see here these are the, this is a, here you can see this is a lateral cutaneous nerve of thigh. This is the intermediate cutaneous nerve, and this is a medial cutaneous nerve. But some of the portions which is broken down because it is since long time we are dissecting here. This is a femoral sheath, which is the anterior surface, which is formed by the fascia transversalis, and posteriorly it is formed by the fascia iliaca, and it encloses the femoral vessels. This is a femoral artery, this is a femoral vein, and inside the femoral vein, you can see there is a great saphenous vein which is opening. And inside the great saphenous vein, other tributaries anteromedially tributaries. This is the anterolateral tributaries, and this is the superficial extrapudental. This is a superficial epigastric, and another is the there is a superficial circumflex iliac. These are the three veins open inside the great saphenous vein, and this great saphenous vein open inside the femoral vein. Here you can see this is a femoral artery, and this femoral artery you can see there are superficial branches. This first superficial branches goes along with this vein. It is called the superficial extrapudental. Here this artery which is goes upside, and it is called the superficial epigastric. This, and then last one here you can see there is another branch. It is a superficial circumflex iliac artery. Here you can see this is a superficial circumflex iliac artery which is goes laterally around to the anterior superior iliac spine, and it makes the anastomosis. Just above to these femoral vessels, here you can see this is a lymph nodes, and this now here you can see this is a genital branch of femoral branch of genitofemoral nerve, which is supplies the skin over the femoral triangle. So this is a femoral branch of genitofemoral nerve, which makes the supplies the skin over the femoral triangle. Now I will show you the boundaries of the femoral triangle. Medially, it is bounded by the medial border of the adductor longus. Laterally, by the medial border of the sartorius. This is the sartorius muscles, and base which is formed by the external oblique muscles. We already discussed it is the most lower fiber of the external oblique, which makes the inguinal ligament from anterior superior iliac spine to the pubic tubercle. And apex, it is the meeting point of these two muscles, adductor longus and sartorius. So this is the femoral triangle which is lies into the upper one third of the thigh. The roof which is already formed by the skin, superficial fascia, deep fascia, fascia lata, and also some cutaneous nerve, medial, intermediate, and lateral cutaneous nerve, which is, and also there is a great saphenous vein. Tributaries are the making the roof of the femoral triangle. Floor of the femoral triangle, which is formed by the medially by the adductor longus. After that, you can see there is a pectineus muscles. Just below to the femoral vessels, there is a psoas major muscles, and lateral to it, femoral nerve. This is a femoral nerve, and lateral to it, there is a muscle. It is called the iliacus muscles. So this is the iliacus muscles, and here you can see just below to the lateral cutaneous nerve of thigh. Directly there is a nerve which is goes inside the iliacus muscles. It is from the trunk of the femoral nerve, it is the iliacus nerve to iliacus. Femoral nerve, it is not inside the femoral sheath, and it divide into the two branches, anterior division and posterior division. This anterior and posterior division, which is divided by the lateral circumflex femoral artery. Here you can see this is the lateral circumflex femoral artery, this is the profunda femoris artery. And profunda femoris, it gives the two branches, medial and lateral circumflex, and which is on the medial aspect. This artery which is goes on the medial aspect, it is called the medial circumflex, and the artery which is goes laterally, it is called the lateral circumflex. And this lateral circumflex femoral artery, which is divided into the femoral nerve into the two division, anterior division and posterior division. Anterior division only supplies to the nerve to sartorius. Here you can see this is the nerve which is innervating to the sartorius. This is the nerve to sartorius. At that level, you can see this is a nerve to sartorius, and it gives the two cutaneous, medial and intermediate cutaneous nerve. This is a medial, and this one is a intermediate cutaneous nerve. Posterior division, it gives the there are many branches. It supplies to the quadriceps femoris. I will, for the better visualization, you can see there is a this is the sartorius muscles, this is the vastus medialis, this is the rectus femoris, this is the vastus intermedialis, and laterally this is the vastus lateralis muscles, and this is a facial arta. Laterally there is a thickening. It is considered as a iliotibial tract. Now these all muscles which is innervated, here you can see this is the nerve to sartorius. Already I have shown the nerve to, this is the inside the subsartorial canal. Subsartorial canal, it is lies apex of the femoral triangle to the lower one third of the thigh, and below to the sartorius muscle, it is called the subsartorial canal. And inside the subsartorial canal, you can see there is a boundaries above by the sartorius, below by the adductor longus and adductor magnus, and laterally by the vastus medialis. And inside this, you can see this is now to vastus medialis, which is goes. Uh, Also, this now it is a saphenous nerve, and also there is a femoral vessels which is lies inside the subsartorial canal. And this subsartorial canal, it gives the last branch of the femoral artery. It is called the descending genicular artery. This descending genicular, which is not a branch, not branch inside the femoral triangle, but it is the branch inside the subsartorial canal. So this is the subsartorial canal, and contents are, we already discussed, now to vastus medialis, saphenous nerve, also femoral vessels and vein and artery, also some unnamed branches from the obturator nerve, which is coming just below to the adductor longus. This is the anterior division of the obturator nerve. This is the gracilis muscles, and it is also supplied by the anterior division. Anterior division also supplies to the adductor longus and the adductor brevis. It is a branch of obturator nerve. After deep to this adductor longus, you can see this is the adductor brevis, and deep to this adductor brevis, you can see here these are the nerve plexus. It is a posterior division of the obturator nerve. So in this way, adductor longus, adductor brevis, and adductor magnus, the anterior division and posterior division lies of the obturator nerve between the adductor longus and brevis. It is the anterior division, posterior division between the brevis and magnus. So here is the same relation: adductor longus, after that anterior division, adductor brevis. After that, you can see there is a posterior division of the obturator nerve, and then adductor magnus. And adductor magnus have a two part, hamstring and adductor part. But right now we will not discuss this thing. Other branches of the, now I will show you the branches of femoral artery. This is the superficial externopudendal. These are the muscular branches here. These muscular branches. This is the superficial epigastric. This is the superficial circumflex iliac, and medially on the largest branch, it is the profunda femoris, and this profunda femoris, it is medially, it is called the medial circumflex. It is a continuations, and laterally, and on this side, this branch which is coming, it is a lateral circumflex, and it divide the femoral nerve into anterior and posterior divisions. So hope you understand all the structure I have shown inside the femoral triangle and inside the inguinal canal. You can understand and you can visualize this thing. After this, uh, you can see this is the extraperitoneal connective tissue, and there is a peritoneum deep to the fascia transversalis, you can see, and this makes the posterior relations of the inguinal canal. So posterior relations of the inguinal canal, mainly it is formed by the uh, extraperitoneal connective tissue, fascia transversalis, and the peritoneum, parietal peritoneum, which makes the posterior boundaries of the inguinal canal. So hope you enjoy the both the things at the same time. It is a femoral triangle and the inguinal canal and the muscles of the anti-abdominal wall. Thank you very much.